We are going to discuss about amino glycosides. So, amino glycoside, as the word itself means amino sugars which are joined by glycoside bonds. Okay, glycosidic linkages. It is derived from soil actinomycetes bacteria of genus. Two genuses are there. One is streptomyces and another one is micromonospora. So, streptomyces genus. There are streptomycin, kanamycin and tobramycin. Micromonospora genus, we have gentamicin and sisomycin. Okay, gentamicin, sisomycin. So classification: systemic streptomycin, kanamycin and tobramycin, paromycin, gentamicin and sisomycin. Topical means in the form of creams we have neomycin and framycetin. So what are the properties of aminoglycosides? So these are highly polar compounds which are means water soluble compounds. These are polycationic carbohydrate containing amino sugars. Okay, they are bridged by glycoside bonds. So they are not absorbed orally. So if given in solution, they get ionized in the solution. So they can't be absorbed orally. So we will give parenterally, like through IM route, like that. So it eliminated unchanged by the kidney. Okay, these are more active at alkaline pH, like 20 times more active in alkaline than acidic. So these are all aminoglycosides are bactericidal in nature. Okay, they act by inhibiting the bacterial protein synthesis. So they are mainly effective against the gram negative bacteria than that of gram positive. So main adverse drug reaction is autotoxicity and nephrotoxicity. Poor CSF penetration is there. They can't cross the blood-brain barrier. So coming to the spectrum, resistance and pharmacokinetics. Spectrum, they are effective against aerobic gram-negative bacilli like E. coli, Proteus, Yersinia pestis, Nocardia, Vibrio cholera, Pseudomonas, Brucella, Salmonella. Coming to resistance, aminoglycoside inactivating enzyme, which is produced by the bacteria. So these aminoglycosides can't work. So low affinity of bacterial ribosomes. So aminoglycosides can't bind to the 30A subunit. So these bacteria, this can be acquired by the mutations in the bacteria. Okay, decrease permeability to the antibiotic. So antibiotic can't enter the bacterial cell. So pharmacokinetics, poorly absorbed from the GIT. So as they are polar compounds, they can't cross the blood-brain barrier. So but they can cross the placenta. So there is a possibility of teratogenicity. So if the mother is if mother is taking the aminoglycosides, then the neonate born will be presented with hearing loss. So they are rapidly excreted by glomerular filtration. So what are the adverse effects? Before only we talked. Autotoxicity and nephrotoxicity are major adverse effects. Autotoxicity due to the auditory nerve degeneration and vestibular dysfunction. So nephrotoxicity and nephrotoxicity, it may damage the renal tubules, low GFR and albuminuria. This will be seen with gentamicin, neomycin and tarbamycin. So neuromuscular toxicity, we will see Curer-like side effects. So they block the neuromuscular transmission. So coming to mechanism of action of the aminoglycosides. Aminoglycosides, these are water soluble. They penetrate the bacterial cell membrane through the aqueous pores and they reach the place between the cell wall and cell membrane, means it is periplasmic space. So then they crosses the cell membrane and they travel into the cytosol by oxygen dependent active transport. So that only we said these are effective against the aerobic bacteria, not for the anaerobic bacteria. These are 20 times more active at the alkaline pH. So aminoglycoside, it disrupt the cell membrane and penetrate the this penetration of this drug into bacterium will occur from the periplasmic space. Okay, inside the cell, these aminoglycosides, as we have discussed, they bind to the 30S ribosomal subunit, acid of tetracyclines, and these inhibit the bacterial protein synthesis by blocking the initiation step, and they also block the termination step by adding the incorrect amino acid. Okay, synthesis of abnormal protein will occur. So means bactericidal activity will occur. Death of the bacteria will occur due to the abnormal protein synthesis. So dose dependent killing is seen with the aminoglycosides. As we increase the dose of aminoglycosides, bactericidal activity also increases. Aminoglycosides pharmacological uses are these aminoglycosides. They treat the infection due to gram negative bacteria than that of gram positive. They are used in streptococcal and enterococcal endocarditis in combination with penicillin. So examples: streptomycin, which is used for aerobic gram negative bacilli. Tuberculosis, this streptomycin is the second line drug, because as there is a resistance of the tubercular bacilli. So plague, brucellosis, we will give streptomycin along with the tetracyclines. In gentamicin, which belong to Micromonospora genus, in UTI we will be using this gentamicin, and in pneumonia we will give gentamicin along with penicillin, and meningitis we will give gentamicin along with third generation cephalosporins like ceftriaxone, and topical uses will be in burns, infected wounds, in eye drops, in conjunctivitis. Kanamycin so is limitedly used due to multi-drug resistant TB. Means only in multi-drug resistant TB we will use kanamycin. Amikacin in TB in combination with other aminoglycosides we will use amikacin. And neomycin, it is used topically in skin infections, burns, ulcers, wounds, ear and eye infections. And hepatic coma is the major side effects with the this, because neomycin is inhibiting the colon bacteria. Okay, so in toxic doses, neomycin may cause a hepatic coma. Thank you guys. Thank you for listening to me carefully.